friends, and welcome to the Growing Happy Babies Birthworkers interview series. In this podcast directory, I make sure that you have the easiest possible time deciding which wonderful birth supporter is right for inviting into your family's journey. All the potential members of your essential prenatal and postpartum village are assembled right here in the Growing Happy Babies directory. Doulas, midwives, prenatal and infant body workers, lactation consultants, and so much more. I'm Adina Kopinski, board-certified lactation consultant and fellow mom. Together, we transition more easily into motherhood. Let's grow some happy babies together. Hello, everyone. Welcome again. Today, I will be talking with Tamar Gordon. She has the wonderful combination of being a physiotherapist and an osteopath. And that's just such a fantastic combination. I can't even imagine how many years of schooling that took. But I'm so happy that it exists in the world. Tamar helps women during pregnancy with discomfort or other kinds of challenges, and then also postpartum with just recovery from pregnancy, as well as pelvic floor physiotherapy after pregnancy. And she just told me that she also treats babies. I love to meet osteopaths and body workers who treat babies because that just really helps their comfort, reflex, digestion, sleep, feeding. And, you know, I work with babies, so that's my soft spot. Hi, Tamar.
Hi.
I was wondering if you could just start us off by telling us how you got to this field. And I guess you can interpret that really broadly because you have so many skill sets.
Wow. Okay. I think I'm going to answer that from the viewpoint of treating women.
Yes. Mm-hmm.
So I trained in general physiotherapy and I started working. And about 2 years into my practice, I realized that there's this whole area of the body that I wasn't really educated on. I sort of generally knew what it did, but I definitely wasn't an expert in it because in general, in like PT school, you don't really study it in depth. And I decided to just go study it and just have a really full education on the body. And when I'm treating someone, to just know everything.
Mm-hmm.
Well, not everything, but more than I knew. You can never know everything. And then as I was studying it, I just sort of fell in love with the idea of treating women and meeting women. And after becoming a mother myself, the meeting women in that pregnancy and postpartum period became something so personal and special. Often women say, like, why pelvic floor? Why are you interested in that area? So I'm not interested in that area. I'm interested in the women who are challenged by that area.
Mm-hmm.
And that's the interaction I enjoy. And when I went into the specialty of treating pregnancy-related pains, like back pain, knee pain, it just felt like this huge gap in women's health because so many women feel that, or hear, it hurts, give birth, it will pass. And that's just so not fair. So the idea of just giving women that assistance in those very, very sensitive times, and when people often look at them as sort of a carrier for their baby, giving them the treatment just feels really right to me.
Yeah. I like that. We know a little bit about this already, but I wonder if you could go more in depth about what your specializations are in terms of how you treat people, either in physiotherapy or osteopathy. What's your unique, aspect that you bring into your healing?
So I feel it's the combination of both worlds. I mean, the physiotherapy world is very about exercise and rehab. And the osteopathy brings the more manual aspect, the holistic aspect of looking at the whole body, looking at the different systems of the body. And I feel that really the combination is the only way to look at right now. It's the only way to look at things.
Yeah.
Because the manual aspect and the effect of the healing touch is so great.
Yeah.
But again, also the aspect of exercising and being sent home with an exerciser or something that the woman can continue doing on her own to help with her recovery. It's not just something that happens in the clinic. It's a whole process she has the ability to continue at home. And I just feel that the combination of both worlds is very right.
Yeah, I love home care exercises. When I see moms and babies for lactation work, I always give them home care for the infant's body, any asymmetries that I see, oral work for helping with feeding, because then, it's not me, it's the mother, and she's helping her baby reach better function. It's
Exactly.
such a richer experience that way when the work happens every day between mother and baby, or between woman
100%.
and her own body, you know?
Yeah.
Yeah.
Yeah,
You're not being
exactly.
the healer, you're helping guide the healing. It's a totally different role.
Exactly. She is the only woman, only person who can heal her own body.
Right.
With the work she does, with the intention she brings, I'm there to help facilitate it, to help guide her. But if she doesn't do the work and she doesn't come with the right intention, nothing is going to happen. And when you come to like a typical osteopathic meeting, there's this, you lie on the bed and you wait for the osteopath or whoever's treating you to do the work for you.
Right.
And that's just lacking a little bit of the full effect.
Yes. Great combination. Love it.
Yeah.
Can you tell us a story? Bring a human side to the work that you do. Can you tell us a story of maybe a woman that you help that's more memorable, more interesting, more educational for us to hear about?
So, well, I'm going to say what I love. And I love when well, I don't love it when she needs to come because I mean she's in pain. But when a woman who came to me during late stages of pregnancy because of back pain that was really limiting her, and we did the exercises and the treatment, and she really, really improved, and she went on to have a wonderful birth. And I'd say about 8 months postpartum, she contacted me again to say that she's experiencing back pain again. But now she's limited with her baby. I mean, she can't bend down to him. It's difficult for her to go sit down with him on the floor and all sorts of things that are so basic for a new mother. She like needed her husband there to help her to get him out of the car. She was so limited. And she came back and we treated her back pain. And after 2 or 3 sessions, there was a great improvement. And she was just able to move freely with her body around her baby. And I mean, think of how limited a mother is if she has such grave pain that she can't lean down to the floor or lean into the carriage to pick up her son. She needs someone there to help her. I mean, it's challenging enough to be a new mom, but to physically not be able to do that is
Right. Yeah.
so difficult.
Hmm.
So to hear the difference, first of all, to be able to accompany her in different stages and to hear like the difference in her day-to-day life that the treatment made to me is, why I come to work every day.
Right. No, helping people. I love to help people forget about me. That's what I like to say. You know,
Completely.
to have such
Yeah,
a to have be having such an easy time that like the fact that once they struggled is like a distant memory to get that really holistic healing.
definitely.
Yeah,
Although as someone who did have difficulty breastfeeding at first and was really, really helped by a lactation consultant, I will never forget her.
for sure, for sure. The people who help us are formative, but I
Yeah,
want them to be able to like one day, like this woman leans over to the stroller, picks up her 18-month-old and
100%.
doesn't even have to remember once this hurt me. Even if they
Yeah,
remember you with appreciation, but that the
yeah.
action, the day-to-day life becomes so easy.
The body has moved on, and
Yeah.
that is really the best outcome.
Hmm. How does the work that you do help contribute to easier, I'm going to say, prenatal period, labor, and postpartum? I think
Yeah.
told us a little bit about that already, but I'm especially interested in maybe the labor portion.
Oh, wonderful. So as part of my clinic, I do like labor preparation meetings
Mhm.
for the couple. And the goal of these meetings are to sort of help the woman understand how to use her body during the different stages, during the contractions, and also during the labor itself. From the physical aspect of just how to move, and I help show her partner, how to touch, where to press, how to assist her, where to support. And also the actual labor. I mean, we practice. I have an ultrasound machine in my clinic and I use it so we can look and we can see the pelvic floor in relation to the bladder and the uterus. And we practice pushing so she can see if she is pushing effectively. And she just comes to labor with all these skills already like registered in her body. So whether she's giving a natural birth or she's has an epidural and she can't feel anything, her body knows what to do. Her mind knows what to do. And I feel, and this is what I hear from patients, she comes prepared. Her husband comes prepared. He knows how to assist her. He knows what his job is. And it like no one knows what will happen in the end, but at least they approach it with a sort of a feeling that they did everything they could to be prepared, and whatever will be will be.
Mm-hmm. Yeah, would you call it childbirth education classes, or specifically like the physiology?
No, it's very specific to the physical aspect.
Mm-hmm. Okay.
We discuss pelvic floor and what to expect immediately after labor, how to deal with those first few weeks, which are very challenging pelvic floor wise. So she has a little bit of information about that.
When a woman works with you, when she's pregnant, do you find that she has an easier recovery physically after birth?
In terms of pelvic floor, yes,
Mhm.
because she knows how to use those muscles. She knows how to contract, she knows how to relax. And then the first weeks after giving birth, when your pelvic floor is in complete shock and it's not really functioning, that is the time when you want to start strengthening it. And when you don't know exactly what you're doing and you're trying to activate a muscle, which is sort of not paralyzed, but like in complete shock and is starting to slowly recover, it's not the best time to learn this new skill.
Mm-hmm.
So they learn it during pregnancy, and then the day after they give birth, I recommend start contracting. And even if you don't feel anything, you're doing something to strengthen those neural connections, and she recovers faster. The pelvic floor recovers faster.
Yeah, fantastic. Um, do you find that the work you're doing with pregnant women is even having positive effects on the baby after the baby's born, or you're not being able to see, or we don't see things kind of downstream as much?
Well, I don't see that in a very direct fashion.
Mm-hmm.
But again, I think of a woman who, first of all, had a positive birth experience because she came more prepared, and that definitely affects those first few weeks. And also a woman who's just more comfortable in her own body. It makes her more available to be there for the baby, to deal with things like breastfeeding, with the baby's needs. And if she's concentrated on her perineal tears or her own aches and pains, it's just so much more difficult to give whatever all that she wanted to give to her baby. So it sort of frees her to be there for the baby more.
Mm-hmm. Yeah, that's a good point. The more the mother's body needs to recover, the less mental, emotional, and physical energy they have
Exactly.
to be mother
Exactly.
child. That makes
Yeah.
sense. Yeah, and it's a good segue. Maybe you can talk for a few minutes about the babies themselves that you work with, and when you work with babies, what kind of outcomes you see, what kind of things you're able to help with.
Amazing. So a lot of women come with breastfeeding problems, and they feel asymmetries, and they feel that the tongue isn't completely loose. So that's when the cranial work for babies really comes in, and just sort of making sure that the movement is right and the movement is symmetrical.
Mm-hmm.
And there's a lot of work on the tongue, playing with the tongue, trying to help the baby move it around and feel more, well, the baby doesn't feel, but gain more control. We work sort of downstream as well on the movement of just the sternum and all the muscles in the neck and in the chest. So that's very breastfeeding related, and that is a very common reason for treatment.
Mm-hmm.
And then there's also babies who come with discomfort in they're gassy, or they have reflex or difficulty burping. It's just because their whole digestive system is so not developed, and the things don't move there freely, and they can get stuck. And I hear about, I treated a baby who hadn't pooped for like 8 days.
Oh, that's so
And
uncomfortable.
medically wise, it's not considered an emergency. It's considered normal, but it's so uncomfortable. It's so uncomfortable. And I work on the stomach, and it's just gentle massage. It's really important that to understand that osteopathic treatment is so gentle. I mean, the pressure on a baby's skull coming out of the birth canal is like, I don't know how many times more powerful than anything that I will do for it. So it's a very gentle treatment that also sort of just facilitates the natural process, which in babies occurs so quickly. Just there to give it a little gentle push.
Yeah. And did the baby poop?
Yes, God bless.
I love that.
How uncomfortable. I can't even imagine.
Yeah. I've got those babies too, and I show them, the mother's like little massage to do, and I'm demonstrating, and like they poop right away.
And like, hallelujah, it really is. It's amazing.
Those poor kids. Honestly, when babies are, it's not constipated medically, right? But there's just something
Yeah,
about
no,
their
it isn't.
digestion that's sluggish and slow, and they're really like you can see them twisting and grunting, and until that poop comes out, when it does, relief.
It's relief. It's relief for the baby. It's relief for the mother.
Yeah.
It's incredible.
Right. So what is something that you wish women would know about their bodies postpartum?
Um, I wish they knew that that it took time and that it's so normal that it takes time. And I wish they knew not to be afraid of the different and strange things they're feeling. Um, I've had like friends of mine call me 2, 3 weeks after birth and saying, Tamar, I can't hold my pee. What's going on here? And I'm like, yeah, sure. I mean, everything there is just in complete old dysfunction at the moment. Give it a few weeks. It's going to improve spontaneously. Don't get upset. Don't be worried. You don't need to go check it. This is normal. So I sort of wish they knew what the normal is in terms of control of your pelvic floor muscles, in terms of pains related to going to the bathroom, to intimacy. Those things it takes time. But again, I also wish that they knew that it's not supposed to hurt for long. I mean, it's supposed to be difficult at the beginning, but then it's supposed to balance out. It's not supposed to hurt forever. And if it does, there is treatment. You don't need to suffer.
Mm-hmm. Right. What's something that you feel is really powerful to teach women before they give birth?
Well, very, very technical thing is I feel teaching perineal massage is very powerful, I have to say. I mean, that's a very physical thing,
Yeah.
but for some reason the perineal massage has gotten like a bad name, or it's every time I hear about it, I hear that, it hasn't been proven as effective in minimalizing the chance of perineal tears. And the truth is that it has. Research really, really supports this. And I feel that every woman who comes and I teach it to her husband, they're like, oh, I didn't know I should do this. And you know what? I read about it, but I didn't realize it was effective. So that is something that I feel is really like an eye opener for a lot of women. But I think women need to trust themselves and trust their body and do what feels right for them, not what they hear, whether it's, a woman who wants a natural birth but believes it's too painful and can't do it, or a woman who really doesn't want to deal with the pain and all she wants is an epidural, but she's heard that giving a natural birth is better. And for, women who take epidurals is weaker, who, succumb to the pain. And there's so many background noises. Just do your thing and try to not be affected. And that's part of what we do in the preparation for birth meetings, sort of understand what she really wants and help her prepare for that.
Mm-hmm. Yeah. Right. And like just for like a little anticipatory guidance, like at what point postpartum, if a woman is still experiencing either discomfort or difficulty, should she reach out for help?
I feel that the 6-week mark, which is when she goes to see her doctor, even that might be a little bit early. I usually recommend to come after around 2 months, 2.5 months, because the spontaneous improvement that happens in those first weeks without any intervention is so great that if she comes to me at 6 weeks And then she comes, and I mean, the picture I see at 6 weeks, the image I see in front of me is not going to be the same in 2 weeks, with or without my intervention. So I recommend them to come when they're feeling that things are starting to sort of stabilize, but not to wait too long, because this is it's an important window of improvement. But that's if there really is no special complaint. If there is really great discomfort or pain, I recommend to come whenever she wants. I would recommend her to come even before the 6-week mark, just to have someone look and give her a little bit of advice, even if we don't do the full exam. But yeah, the improvement is so great. You should really just let your body do its thing for those first few weeks.
Yeah, bodies know how to heal, in most cases.
Yeah, definitely.
Yeah. Okay, wonderful. It was so good to talk to you today, Tamar. Thank you for coming.
Pleasure. It was really, really nice to be here. Thank you.
Friends, check out the full directory for every interview we've done up until now, housed at my website, growinghappybabies.com. But before you go, I've got one question. Are you the kind of person who learns better by listening or by doing? In my 2-part online prenatal breastfeeding class, the Pocket Prenatal, I blend the basics of breastfeeding with practical hands-on skills. Choose to watch the videos on your computer or phone, read through the transcripts, or pop in an earbud, take a walk, and listen to the audio-only podcast version. After you've dived into the what's and whys of breastfeeding, join part 2, our live hands-on class, where we roll up our sleeves and practice the how of breastfeeding. Experience hand expression, learn how to size yourself for better pumping, practice bottle feeding techniques that improve your baby's sucking skills, and use easy bodywork exercises to help your baby's comfort, sleep, and digestion. You're going to walk out of this class with an essential toolkit for navigating early motherhood. This is the class every baby needs their mother to take. Go to thepocketprenatal.com and use your listener code, growinghappybabies, for a special 10% discount. See you there.